Hey, welcome, welcome. Happy New Year. I'm Dr. Michelle Sands, in case any of you are new or do not know me. And we're doing a kind of a New Year's Q&A, kind of everything menopause, perimenopause, hormone replacement that you want to know, because it's something that we don't talk about enough. I mean, there are some celebrities like even Michelle Obama and Jennifer Aniston and even the Kardashians lately have been talking about menopause and getting the word out there. Oprah has talked about it as well, but still it's a little bit taboo. Most of the time women are not properly treated. They're put to the side. Their doctors don't really know what to tell them. And so I like to do these Q&As to kind of help you guys out and just answer any questions that might come up. So let's see. I think did I freeze that for a second there? Okay, we're good. So I wanted to address one question I've been getting a lot because it's the new year. People have their New Year's resolutions. A lot of them revolve around weight loss, fat loss, eating better, all these things. And one of the questions I got a lot over the past couple of weeks is, why am I so hungry all the time? What is going on? Is that part of menopause? Because a lot of women are asking me, it seems like as soon as I hit like 45, 50, all of a sudden my hunger is like ravenous. Like, it's funny, I was talking to one of my fellow hormone specialists that works for me at Glow Natural Wellness, and we were talking about how when we were in our 20s, you would go all day and you'd be like, oh, I forgot to eat lunch. And like, you totally forget to eat a meal. But when you hit menopause, you can be working and you can forget that you ate lunch and you can eat again. So like, you're like, oh, did I even eat? Because I'm starving. And so it's really interesting because it's almost like you feel like food is like, doesn't fill you up anymore. And you feel like you can basically like eat the whole refrigerator, just like, if you have any college boys or high school boys, like they have that appetite, and it's because they're so active. And in menopause, we might not even be as active as we used to be. So what's going on? We expect the hot flashes, we expect the vaginal dryness, insomnia, a little bit of weight gain. These are all common things, but nobody really talks about the hunger and the cravings. And so it is partly due to your changing hormone levels. They actually did a study in about 2014, and there was about 100 women who were premenopausal and then another 100 women who were in the menopause transition. So they were at some stage of perimenopause, menopause, postmenopause. And they actually found that the women who were in that menopause transition had a much higher level of hunger, much lower level of satiety, meaning when they ate their meal, they did not even feel full. And so it's not your willpower, it's your hormones. And so what hormones are at play here? Well, estrogen, during perimenopause, your estrogen starts to decline, then at menopause, it kind of tanks, and your ovaries no longer make hardly any estrogen. You do make a little bit of estrogen from your adrenal glands, but it's basically nothing compared to what you used to have. And so estrogen is actually an appetite suppressant. So estrogen dampens your appetite. So it helps you just to actually feel like you're not as hungry anymore. So when your estrogen levels decline, then you don't have that inhibition to your appetite anymore, and you might feel like you need to keep eating. The other thing that goes hand in hand with that estrogen decline is something called leptin. So leptin is actually the hormone that's produced by your fat cells that basically helps you regulate energy. So leptin is there, it's designed to basically be a feedback with your brain to say, okay, we've filled up our fat cells, now we've eaten enough, we don't need to eat anymore, we have plenty of energy reserve. And so when you have enough leptin, then you're satisfied. And there is a correlation. There was actually a study in 2020 correlating menopause, the loss of estrogen and progesterone, the slowdown of the digestion that correlates with it, and some changes in the microbiome to a change in leptin and the body's ability to respond to leptin. There's something called leptin resistance that can happen. So even if you have enough fat cells, you might not get that message to your brain. So leptin comes into play, and then its partner, or its kind of like alter ego, is ghrelin. And ghrelin is also a satiety or a hunger hormone. Leptin is the one that lets you know you're satisfied. And then ghrelin, you can think of it like the gremlin. That is the one that tells you that you're hungry. So it's the opposite of leptin, it's the hunger hormone. And ghrelin levels tend to increase in perimenopause and menopause, and that makes you feel hungrier. And so a lot of times, if you have higher ghrelin levels, just that baseline, you're going to have more cravings. You're not going to be satisfied as much. And that's because the reason why you have more ghrelin is because the ghrelin is actually produced by the cells in your GI tract. And they signal your brain to tell you when your stomach is empty. And because we have slower gut motility as a result of decreased estrogen and progesterone, then you actually feel more hungry between your meals. So that's another kind of hormonal thing. And then the other hormone that comes into play is cortisol. And cortisol is our stress hormone. And cortisol tends to be more of an issue when progesterone is lower as a result of your ovaries no longer producing, you no longer have your reproductive cycle. And so therefore you don't have as much progesterone as you hit perimenopause. And that can make cortisol go up. We also have changes to how our moods are and how we can handle stress. We have changes in our inflammation, and all of that can increase cortisol as well. And that can make you feel hungrier than normal and actually increase cravings for things like sugar. And then the other issue with perimenopause and menopause, and many of you know this, sleep tends to take a hit for a couple reasons. Number one, progesterone is a very calming hormone. It helps us with GABA, which is a very calming neurotransmitter. And so when progesterone starts to decline, the first symptom that we experience in menopause is often trouble sleeping. And then when estrogen declines as well, we have trouble staying asleep. And so the combination of these two, in addition to night sweats, in addition to having to get up to pee all the time, all of this kind of turns into disruptive sleep. So you may not be getting enough sleep. You may not be getting quality sleep. And there's a huge correlation between sleep quality and sleep quantity, sleep, not sleep. And if you lose just a few hours of sleep, that can actually increase your desire for sugar and sweets and carbs and make you hungrier. And you're going to be awake longer, so you're going to have more time to eat. And then also your metabolism also declines when you don't sleep by as much as 10%. If you sleep less than 6 hours, your metabolism can decline as much as 10%. So those are all the negative, right? But I never like to leave you with like the doom and gloom. That's not my style. We definitely want to give you some solutions to what to do about these cravings. So hormone replacement aside, as you guys all know, I'm a huge fan of like, if we have low estrogen, low progesterone, let's replace that if we can. But that aside, what you can do is, number one, don't restrict your food. So don't set yourself up for the new year. Anytime you're watching this, if you want to get healthier, you want to lose weight, you want to lose body fat, don't restrict whole food groups. Don't try to restrict your calories. Focus on a few key things. So number one, protein. Protein is your best friend because protein is the most satiating of the macronutrients, and it also has the highest thermogenic effect, meaning when you eat 100 grams of protein, you actually burn as much as 30% of those calories just in the digestive process, just in the work your body has to do to break down those amino acids into usable components that your body can use. So protein is great. It keeps you full. It also helps to reduce sugar cravings when you eat protein, and you burn more calories just eating it. So that's number one. Number two is fiber. Fiber is absolutely amazing. Number one, fiber is like a bulk, so it actually makes you feel full. And fiber you can get from fruits and vegetables, all different colorful fruits and vegetables, nuts, seeds, legumes, whole grains, all of those things are fiber rich. I love getting my fiber from vegetables, fruits, and legumes, and nuts and seeds. I don't do too much of the whole grains, but there's absolutely nothing wrong with them if you want to incorporate those into your diet for sure. So the fiber, you want to aim for 25 to 35 grams of fiber per day. And if you don't know how much fiber you eat, you can download like an app on your phone, something like MyFitnessPal. There's lots of different ones. You don't have to use it for weight loss or anything like that. Just only track your fiber and see if you're hitting that fiber goal. And if you're not, then that could definitely be a reason why you are feeling hungry, because not having enough fiber will definitely, you don't have enough bulk in your diet. And so the protein, how much protein, someone asked how much protein should you eat? So I have a really simple equation for protein. So if you take your height, so if you're 5 feet tall, and that's the minimum, even if you're 4'11", start with 100 grams of protein per day. So that's the baseline, is 100 grams. And then for every inch over 5 feet you want to add 5 more grams of protein. So if you're 5'2", you're going to have the 100 grams plus 2 inches over. That's 5 times 2 is 10. So you're going to do 110 grams of protein. I'm 5'5". My minimum is going to be 125 grams of protein. I often eat more than that because I work out and I don't restrict my calories. So I often eat more. So that's the minimum. It's not the maximum. And you might say, well, that's a lot more than the USDA or the RDA recommended daily allowance for protein. Why are you saying more than what the RDA says? Well, the RDA is like the minimum to not feel. That's the minimum number so that you don't like get sick. But we're talking about optimizing health, not just not getting sick, but we're talking about hormone health. We're talking about body composition. We're talking about feeling good, not feeling hungry, all of those things. So that is kind of like my couple of tips for food. And then water, make sure you're drinking enough water, especially if you increase your fiber. Definitely want to increase your water because you don't want to get gas and bloating. And with the fiber, if you're currently on 0 fiber right now, like you're hardly eating any fiber, gradually increase that, because going from hardly any fiber to 30 grams of fiber can be a little difficult. It's like running, right? So if you're going to start, if you want to run like a 5K and you don't run at all, you're not going to go out and run 3.2 miles today. You're going to start with like a 5-minute run and maybe a walk run. So you're going to do the same thing with changes to your diet. You're not going to do it all at once. You're going to do baby steps so that you get those things in. And then, focus on sleep. If you have to take something to help you sleep, something like melatonin, calming herbs like lemon balm and chamomile and things like GABA. These are all great tools to help you get better sleep so you have less cravings. So hopefully that's helpful. And then of course, I just said one of the reasons for these cravings is because estrogen is a satiety hormone. It helps with inhibiting appetite. So if you are experiencing other symptoms like increased blood sugar, hot flashes, night sweats, loss of libido, rapid aging, vaginal dryness, any of these things that you also want to look into hormone replacement, then that can actually help your appetite as well. Awesome. So let's see. Let me go ahead, and so that's my little spiel about your cravings. If you have more questions on that, pop them in the Q&A. So I'm going to go ahead and read some questions now. So let's see. I recently changed Permarin cream to Bias cream and got significantly breast tenderness and gained 6 pounds. Trying to adjust dosage. Is it normal to have to trial and error? Please talk about DHEA. All right, so let me address that. So Permarin is made from horse estrogen. And so it's a lot higher dose. Basically, it's a lot more concentrated than human estrogen. So if you are going like at the same dose in that change, then you might notice that you feel a little bit different. So it might take a little bit of time for your body to adjust, and just making that adjustment can make your body like hold on to some water. Anytime your hormones are changing, you can have a little bit of water retention, but that 6 pounds, it's not that, it's actually water retention. So definitely keep working with your practitioner to adjust dosage, and just know that it's much healthier to use a bioidentical hormones than it is to use horse estrogen. So you definitely want to keep going with the bioidenticals and just to have a little bit of a adjustment phase, probably until you get the right dosage. And you also might want to adjust if you have breast tenderness. You might want to put your hormone creams, like your estrogen cream, below your waist, like on your inner thighs, behind your knee. That can help as well. And then talk about DHEA. DHEA is an amazing hormone. It's an anti-aging hormone. It is a precursor to testosterone. And so we like using DHEA in our practice for a variety of different reasons, but it's wonderful for women to bring their testosterone levels up to a optimal range with having less side effects of like testosterone therapy. Although too much DHEA can also bring your testosterone too high, and that can also, you can have things like an enlarged clitoris or hair loss, male pattern balding, belly fat gain, irritability, acne, all of those things, growing hair where you don't want it, like on your face. So there's definitely, no hormones are perfect in any dose. You always want to make sure that you're getting the right dose. Awesome. Let's see, do hormones elevate your blood pressure? Actually, it's quite the opposite. At the right dose of hormones, you can see improvements to your blood pressure, improvements to your blood sugar, improvements to your cardiovascular health. But with hormones, it's very Goldilocks. So hormones are, they are your body's very sensitive. When we think about like the total dose of hormones that a person needs, it's actually very little. So it's not, we don't have massive hormone doses on a daily basis. And so just like anything, it's the dose and the delivery method that's most important. So making sure you're testing your hormones, making sure that you're dosing appropriately, and then retesting your hormones to ensure that you're in the right ranges to get the best results. So nothing is perfect at all doses. You want to make sure that you're working with someone who's knowledgeable and skilled. One of the things I'm not a huge fan of, and just because I'm not a huge fan of it doesn't mean it's wrong, but I'm not a huge fan of pellets, because pellets tend to use super high doses and it's not sustainable for the body. And people sometimes feel really, really good for a very short amount of time, and then they start getting side effects. So as a naturopathic physician, I'm all about, minimal effective dose. Give the dose that's going to be protective, give the dose that's going to be helpful and make you feel your best, but you don't need to do more than you actually need. And everybody's going to be different. I might need a very small dose, while someone my exact height, my exact age, my exact, weight, size, activity level might need a vastly different dose, just because of how our bodies absorb things. Let's see, I'm currently on an estrogen patch. Will a blood test show if my estrogen levels have changed? I heard you talk about saliva tests for creams. Is it the same for the patch? Topical hormones don't show up in blood serum as well as they do in saliva. So with the patch, also, it's being transdermally delivered. So whether you're rubbing it on with a gel or a cream or a patch, you won't get the full picture in a serum. You will see some change, but you won't see the full picture of your hormones. So I would actually recommend either capillary blood, which would be a blood spot test, or a saliva test. Saliva is going to give you your free hormones, and the blood spot will give you your total hormones. The clarification, replacement hormones elevate your blood pressure. I'm saying that it depends on the dose. If you're on a dose that's not right for you, then you can have adverse effects, especially with androgens, elevating your blood pressure. But if you're on the right dose of hormones, then they actually have been used to help to regulate or lower blood pressure in people with high blood pressure. It's not going to lower your blood pressure if you have normal blood pressure, but at the right dose, it should not, hormone replacement therapy should not raise your blood pressure unless you're on excessive doses, like super physiological doses. In our practice, and most naturopathic physicians and most doctors that are trained in like anti-aging medicine will use what we call physiological doses. That is the dose that is normal for the human body to have on a daily basis. However, a lot of like med spas and some clinics that, they just want to get you in and out, they will use what's called the super physiological dose, which is a dose that no women should actually have. And so this is where we see issues like side effects happening. What is the best treatment for heavy and painful periods caused by fibroids or womb lining? So one of the number one causes of fibroids and heavy periods is toxicity. So xenoestrogens in the environment, BPAs in plastics, pesticides, heavy metal toxicity. These are one of the major contributors because there's a lot of estrogen mimickers in these toxins. And so a lot of these symptoms that we call like estrogen dominance is not really actually estrogen. It's these xenoestrogens, these fake estrogens, these man-made estrogens. So that's the number one thing you can do is reduce toxicity. And then progesterone can be super helpful with balancing out any excess estrogen. You can also use things like DIM, which is a herb to help with estrogen detox, and also milk thistle to help your liver. So liver is one of the main detox pathways for used estrogen. So estrogen has to be broken down into its metabolites, and then it has to be packaged up and then excreted through the stool. And so if you're constipated, you might be recycling your estrogen. If you have any toxicity, that's going to affect your fibroids, and also balancing the estrogen and progesterone. Progesterone is usually what drops first as women hit perimenopause and menopause, and we start to see things like fibroids and cysts and things like that. So that's number one. And then castor oil packs are super helpful too for reducing fibroids, helping to break down the fibrous tissue, both in the breasts and in the uterus, in the ovaries. So castor oil packs are super helpful for that. So is there a target range for hormone levels for menopausal women? So if you're replacing hormones, then there are reference ranges that we use, whether we're doing topical hormones, oral hormones, patches, and it's usually timed specifically for the test. It's going to be different range for blood, saliva, blood spot, all of those things. So yes, so we look at how you're replacing your hormones, when you replaced your hormones. If you're in menopause, it doesn't matter what day, but there's a specific range that you want to get in, and you can look that up. See, thanks for doing this. What are your suggestions for natural options for hormone replacement therapy? I've heard vaginal, creams, patches, implants in the buttocks. Super confused. Okay, so there's there's creams, there's gels, there's patches, there's pellets, which is the implant in the butt that I don't really care for. There's vaginal hormones that you can use vaginally. So there are all these options. And so it's wonderful that we have all these options. And there's oral, there's pills, there's sublingual hormones. So the least side effects comes with topical. So topical could be patch, topical could be gel, topical could be cream. And the patch sometimes has the adhesive that you have to put the patch on with does cause irritation for a lot of women. It's an irritant that keeps the patch on the skin. So I see the least side effects of all with creams, because hormone creams can be rubbed in, and there's very little side effects. You can use less of topical hormones to get straight into the bloodstream and straight into the tissues, whereas oral hormones, they have to go down through your digestive system, they have to be metabolized by the liver, go through the gut, and so you lose a lot of that hormone, so you need a much higher dose. And then when they get metabolized by the liver, that causes some clotting factors, so that can have issues with stroke and clots. There's more side effects with oral hormones. Also, you can get more nausea, headaches, things like that. So topical hormones have the least side effects. It's the ones that we use in our practice most often. Pellets, they're not regulated, and they tend to be super high doses of hormones. And with the pellet, you get it inserted and you get like a rush of hormones. And then it kind of like dwindles off, but you have to wait 4 months to get a new pellet inserted. And if you have too high of a dose, well, you're kind of screwed because you can't really take it out. Whereas with topical hormones, if you want to adjust your dose, you can adjust it on the fly. So someone can be on a dose of topical, they can say, oh, well, I'm not getting the results that I want, so we can increase the dose, or they can be on topical and they can maybe feel like they have too high of a libido or something's going on, so we can reduce the dose. And it's very easy to do because you're controlling it yourself. So I'm a fan of topical hormones. The downside or the con of topical hormones is you got to put them on every day. You got to remember to use them. You've got to rub them in well. With the patch, you have to remember to replace your patch every so often. Like I said, some people have irritants, but it's not bad. And with the pellets, you have to actually go in and get a surgical procedure. So there's risk of infection, and you have to wait until it wears off, which then a lot of people start to get their symptoms back, and then you put it in again. And like I said, it's usually high doses, so we see the side effects start kicking in a lot of times after probably like the third patch or the pellet insertion. So it's up to you though. It's a personal choice. And so, you can choose what you think is right for your lifestyle. And the best one is the one that you're going to use consistently, right? Awesome. All right. Thank you. Let me just clear that. Okay. Let's see. My husband has a bit of an older man belly, not extreme, despite exercising and eating a Mediterranean diet. His doctor says his testosterone level is in normal range, but he's a conventional MD. Is there a more narrowed range, a more holistic, integrative world for male testosterone levels? So the interesting thing is that male levels, it's the same whether you're conventional or functional, doesn't matter, but the range is pretty large. It's like, I believe it's like 200 or 300 all the way up to 1200 for men. So it's a wide range. And so a lot of people with men don't feel well under 500 or 600. And so he might need some testosterone. He could be in that range, but he might need some testosterone. But it's not, the testosterone for men is usually not what's causing their belly. It's usually their lifestyle. So I would recommend weightlifting for him. So his weightlifting is actually putting on muscle. Strength training is one of the best ways for increasing testosterone effectiveness. So even if you don't have, even if you have less testosterone, you can make more testosterone receptors when you lift weights. So I would really recommend like hard strength training, like where he's actually in a lower rep range, heavier weight, actually pushing himself, and that will really help quite a bit. So that's my kind of 2 cents. But I mean, if he wants to try some testosterone, he totally can, especially if he's having other issues like fatigue, loss of libido, stuff like that. So you might want to check on that. And he can look, and if he knows what his testosterone levels are, then he could see if he's at the low end of the range, high end of the range, middle of the range. And then he can also see if they continue to decline. There's nothing wrong. Men can get testosterone much easier than women can, because the standard of care in medicine, it's really a horrible double standard. Men can go in and complain about their testosterone levels or symptoms of low testosterone, and they'll be tested. The standard of care is to test their testosterone. If they're below a certain level, to give them testosterone replacement and then to retest. A woman can go in to the clinic, same clinic, with all the symptoms of menopause. And standard care is not to ever test her hormones and to give her antidepressants or to give her birth control pills and send her on her way. And then if she keeps coming back and complaining, then she might get some oral hormones if she's already done the antidepressants and she's still having like major hot flashes. If she has any of the other symptoms, she'd be lucky to get hormones. So it's not really fair, but men do have a much easier time getting hormone replacement. The other question with the vaginal hormones, I forgot to mention, those vaginal hormones are wonderful because vaginal hormones tend to stay local to the vaginal mucosa. So if you're someone for some reason who is maybe going through cancer treatments or is afraid of hormones, but has vaginal dryness, vaginal atrophy, painful sex, frequent UTIs, lots of discomfort in the vaginal area because your vagina starts to shrink. So your labia start to shrink. You can start to get a lot of irritation and discomfort when you are just like wearing clothes. A lot of women tell me that like it hurts to put on underwear. And so vaginal estrogen can be super helpful with this. And when you use the vaginal estrogen, it's usually a low dose, and that stays in the vaginal mucosa, so absorbs and stays in that area. It doesn't really go systemic, so it won't raise your blood levels of estrogen. It might be a teeny tiny, minute, like even non-measurable fraction of what gets in the rest of the body. And it's really wonderful. We actually are just releasing a vaginal moisturizer, rejuvenator that has low dose estrogen in it, and that's going to be available without a prescription to the general public. It's one of the most effective vaginal rejuvenation formulas available without a prescription. So I like vaginal hormones for that reason, and you can do both. So a lot of our practice in the Healthy Hormone Club, women that work with us, they're on topical hormones and vaginal hormones. And so, because you're going to get like that restoration to the vaginal area, improved sensitivity with sex, improved orgasms, improved elasticity, improved hydration. That's going to be quicker for you if you use hormones vaginally as well. Awesome. Okay. I just had surgery for estrogen dominant breast cancer and would like to lower bad estrogen. I'm 49. I still get regular periods. How would you suggest I do that? Number one is going to be toxin avoidance and detoxification. So really go through your food, like all your food prep containers, make sure there's no plastics, make sure there's no Teflon, make sure there's no nonstick coatings. Look at plastics that you might be storing your food in, plastic water bottles, avoid cash register receipts, any cleaning products that might have any toxins in them, personal care products, things like makeup, shampoo, moisturizers, soaps, all of those things, go through and clean those out. Try to eat organic so that you're not getting the pesticides. And so that's like number one. Even like taking your shoes off before you come in the house, because you kind of track pesticides and herbicides on your shoes. And so leaving those outside, opening your windows to kind of get some fresh air in your house because you have off-gassing from all the flame retardants and all of those things. Change out your shower curtain. So that plastic shower curtain, if you take hot showers, it off-gasses estrogens. And so things like that, whole house water filters, things like that are going to be like your number one way to improve. Number two, make sure you're having regular bowel movements. So if you're not, increase your fiber, increase consumption of cruciferous vegetables because those help with estrogen detox, really optimize liver health. So doing things like herbs like milk thistle, drinking plenty of water, getting exercise. So exercise is a great way to sweat on a daily basis. Exercise or sauna is going to help to optimize that. Taking a daily supplement with DIM. Our Daily Glow supplement is really good. It has everything you kind of need for your like multivitamin, multi-mineral, but then it also has DIM for healthy estrogen detox, has support for your liver, has support for your thyroid, support for your adrenal glands, but something like that would be great. Also, like things like N-acetylcysteine or NAC can help with estrogen detox. So those are all things that I would look at. You can, there's some estrogen metabolite tests that you can take to see how your body is breaking down estrogen to make sure you're breaking it down the proper pathway. And so all those things can be super helpful. Do you check hormones like thyroid and adrenals when you join the hormone club? Is that treatment included? So for the Healthy Hormone Club is a bioidentical hormone replacement program. So the test that comes with that is the sex hormones, but you can always add on thyroid and adrenals. We do look at symptoms of thyroid and adrenal health, and we do look at that on your symptom assessment. And when we do your consult, we will let you know if you have symptoms that do point towards possible thyroid dysfunction, possible adrenal dysfunction, and then we might recommend that you test those things, or we might recommend ways to improve function of those glands. But in order to keep the cost low, we can't test everything, but we do offer testing for pretty much anything that you need. You can add on tests for those things. Awesome. My gynecologist prescribed progesterone 100 milligrams and estradiol, I believe you're saying 0.5 milligrams daily. Is this the same as what you prescribed for a 68-year-old woman? So it really depends because every 68-year-old woman is different. So we don't have a one set, this is what you get if you're 68 years old and you're a woman. It's really going to depend on your hormone levels currently. It's going to depend on your lifestyle. It's going to depend on your symptoms. So it's going to be different for different people. That could be good. It may or may not be. You'd want to test your levels and see where they are. And then once you're on those hormones for a few months, you want to retest and see if you're good, if your levels are good and how your symptoms are. If your symptoms are good and your levels are in range, that's great. If your levels are in range, but your symptoms are still there, then you might want to be at the higher end of the range or the lower end of the range to make sure that you get the symptom relief as well. And then in addition, there's things that you can't see that are happening, you can't feel that are happening, things like brain health, things like heart health improving, things like your bone density improving. Those are all like happy side effects of estrogen replacement, sleep improving, mood and memory. These are all kind of things that you can't actually feel, but you can see if you get bone density tests or you get your cholesterol checked after about some time. You can see these improving as well with your hormone replacement. What levels do you want your estrogen and progesterone? So if you're doing, for instance, a saliva test and you're on estrogen replacement, it's going to be anywhere from 3 to 12, depending on your symptom makeup. And then for progesterone, if you're doing saliva and you're on replacement progesterone, anywhere from 300 to 3,000. So that's just one range for one type of test. It's going to be different depending on the type of test that you're doing. And also if you're in the UK or in America, but, and there's different ranges. So it's interesting because there's a menopause range. There's a healthy range for cycling women, and then there's a menopause range. And what happens is, and the menopause range is non-existent. It's very, very small. It's almost nothing. And so what happens is women go into their doctor and they're I'm having all these symptoms. I'm having hot flashes, vaginal dryness. I never want to have sex with my husband, all these things. I'm not sleeping well. My cholesterol seems to be going through the roof. I'm hungry all the time. So all these symptoms, and they go to their doctor and they beg for a hormone test, and they get one, and their doctor's well, your hormones are normal for menopause, but normal for menopause is nothing. And also normal for menopause is all those symptoms that woman was just complaining of. So they're oh, you're normal for menopause. That's how it's supposed to be when you get older. You're not spring chicken anymore. Here's some antidepressants so you don't hate your life so much, or drink some more wine, or all these things that I hear. And it's because you're not trying to be normal for menopause. You want to be optimal for menopause, which is having hormones. Because here's the deal: age 45, 50, 40, even in 40s, some women are noticing this in their 40s, hormones are starting to decline, and then they get to be flatlined. And I don't know about you, but you still have a lot of life to live. I'm 48 years old. I got half my life to live. My son's only 7 years old. He's going to be 8 in a little while, in April. And I want to see when he graduates high school. I want to see him get married. I want to see him graduate college. I want to see him buy his first house. And so I don't want to live the next 50 years of my life hardly getting by, hating life, not being able to enjoy myself, not to be able to remember where I put my keys, be uncomfortable. I really need to live my life optimally. And so it used to be that women didn't live much longer past menopause. And so it was okay to not have hormones, but we need to have our hormones so that we can have our life, so we have our function. And so that's really why I do this. That's why I'm so passionate about like letting women know that there are answers, there are safe answers. And honestly, we're seeing now, I just went to the longevity summit for the American Academy of Anti-Aging in Vegas. There's an annual summit every year where they look at the newest science in the field of medicine, anti-aging, healthcare, and a lot of it was about hormones. And what we're seeing is that the risk of not replacing your hormones is actually greater than the risk of replacing your hormones if you do it correctly. So there's always a caveat, like there's no one dose, there's no perfect, like this is the one dose of estrogen, progesterone, testosterone that every woman should have. It's not like that. It's individualized medicine, testing, don't guess, test. And don't DIY it. I know you can buy like progesterone cream online. This isn't an area where you want to DIY. You can DIY like your essential oils and your sugar scrubs and stuff like that. But don't DIY your hormones. Like get that right, because this is something that's going to take you for a long time, and it's going to really sustain your brain and your heart and your breasts and your vagina and your sexual health and your energy and really like you as a person. So I'm going to the next question now. So sorry about my little soapbox. Hi, I'm 46 years old. I have pretty regular cycles and recently did a blood, saliva, sex hormone panel between day 19 and 21 of my cycle per your suggestion. Yes, and the reason why between day 19 and 21, we're looking for 5 days after ovulation. That's when your hormones are going to be like kind of at their peak, and we can kind of assess. And that's just the ranges for the test that work best during that time. See, my cortisol ×1 came back really high, 27.3, but I don't feel stressed at all. My sleep is pretty good. I was surprised to see that my total testosterone was high too. Let's see, I'm very confused. Do you have any idea why my test would be high and how to reduce it? Is it dangerous to be in an elevated state? Not sure if I should be starting hormones yet. Okay, so cortisol, I'm looking at one cortisol marker. That can be very deceiving because cortisol can change on the daily. And so usually if I'm testing cortisol at all, I'm testing at 4 points during the day. So we're testing your early morning cortisol, we're testing your cortisol like after an hour after waking, then we're testing midday, then we're testing late afternoon, or we're testing evening cortisol. So then we could see a pattern. If you're doing a blood test, and I don't know if you did the cortisol with saliva or blood, because you said you did blood and saliva, just the fact that the act of doing the test can be stressful for some people. So that can raise your cortisol depending on like what you ate, how you slept, any stress going on in your environment, that could have raised your cortisol. So I wouldn't put too much worry into that, especially if you don't feel stressed and your sleep is really good and you have a lot of energy. You might want to just like adaptogenic herbs are wonderful, things like ashwagandha, rhodiola. That's just going to kind of help to modulate your cortisol, and basically like if it's too high, kind of bring it to midline. If it's too low, bring it to midline. That's why they're called adaptogenic herbs. But testosterone, women can sometimes have a little above the range testosterone for reasons like PCOS. Sometimes insulin resistance will raise your testosterone above range, but you might have like, you might be just a person who has higher testosterone. So if you don't have any symptoms, because the ranges are average, right? So it's like This is the range for the majority of people. This is the healthy range. If you're slightly above the range, it's just you're outside the average, and it's not necessarily a bad thing if you feel okay. So if you're not having facial hair, lots of acne, if you're not losing hair on the top of your head, if you're not experiencing belly fat, if you're not experiencing like irritability and aggression, then you don't have to do much about it. But if it looks like you, based on the numbers you said, it looks like your progesterone can probably be improved quite a bit, because that's a little bit low, and that's normal. At your age, at 46, that's the first thing that's going to decline. The estrogen looks pretty good. So if you're feeling good, you probably hold off on hormone replacement for a while and just do all like the healthy lifestyle things. So I wrote a book, Hormone Harmony Over 35. It's behind me here. That is all the things that are not hormone replacement. So that's diet, exercise, liver health, stress reduction, all the things that are going to help your hormone system work optimally if your ovaries are still working. And then once your ovaries stop working, and it's normal, and it's not anything you did, it's a normal state of hormone decline. It's the end of your reproductive cycle that happens around age 51. It can happen anytime from 35 up, but for most women, once their menstrual cycles start to get super irregular and when they stop, then they're not making any more estrogen and progesterone anymore. And any time between when you start feeling crappy, whether it's lack of sleep, whether it's weight gain, fatigue, whether it's lots of wrinkles all of a sudden, crepey skin, vaginal issues, any of those things, low libido, any of these things can be a signal that like it's time to balance your hormones. And that's when I would get a test like this. But you don't have to start right away. You can do all those other things to help with balancing the hormones you do have. Let's see, I'm considering estrogen pellets. Are there any negative effects? The negative effect is that you can't change the dose. So if you get too high of a dose for you, then you could have some estrogen dominance issues, and there's nothing you can really do about it. The benefits are that you don't have to think about it. It's already in there. But I would definitely make sure that you're getting progesterone as well to balance it out. Even if you don't have a uterus, you still want to make sure that you have your hormones balanced. So a lot of people don't understand, like, progesterone is like super important. Progesterone eases anxiety. It promotes healthy memories. It helps to prevent the overgrowth of certain cancer cells. It helps prevent, of course, we know about the endometrial lining. So that's the one that everyone thinks is the only important thing about progesterone. But it helps with your metabolism. It helps you use fat for energy. It helps you handle stress. It helps with hot flashes. It helps with joint pain, eliminates migraines, helps with insomnia, helps with libido, helps slow down the aging process. So progesterone is a super important hormone for women, but also for men too. And so it's just men at a lower level. So I would definitely not just get estrogen. I would definitely, if you're going to get estrogen, especially a pellet, it's going to be a very high dose. I would definitely get progesterone as well, because you want to be balanced. Concerned about hair loss. So hair loss in perimenopause and menopause, hair loss can be so many different things can contribute to hair loss. I actually have a video on YouTube where I'm going to put the replay of this Q&A that talks about the different reasons for hair loss, especially in women over 35. So I'll just kind of briefly give you some reasons why you might be experiencing hair loss. Number one is going to be thyroid dysfunction or hypothyroidism. So a lot of times that's one of the symptoms that we'll see. And if other symptoms of low thyroid would be cold hands and feet, constipation, fatigue, depression, things like that, dry skin. So if you have any of those things in addition to hair loss, could be your thyroid. Definitely would get a full thyroid panel. So we're talking T3, 3 in total, T4, reverse T3, and thyroid antibodies. So we want to check on all that. Another reason for hair loss would be poor nutrition. So not getting enough protein, not getting enough minerals. That can cause hair loss. Stress, emotional stress, or even like a stressful event like the death of a family member, even like something that's a good stress, like a wedding, things like sicknesses like COVID. And in those cases, your hair is going to start falling out 3 months after this incident. And even with nutrition, it takes about 3 months for your hair cycle to react to whatever's happening in your life now. So even if you started eating healthy and you're still having hair loss, it could be diet, it could be stress, it could be sickness, it could be thyroid. The reason, a hormonal reason for hair loss is when estrogen and progesterone start to decline, but testosterone doesn't decline as much, or there's a imbalance to your androgens to your estrogen and progesterone, then we have something called male pattern baldness, or we start to see the hair receding at the hairline, at the sides. You start to notice that your part gets bigger. And so those are kind of indicators that you have like an androgen dominance hair loss, because estrogen and progesterone really help with the softness of your hair, the thickness of your hair, helps with the hair follicle. And then once those go away, then testosterone becomes more dominant, because there's something called sex hormone binding globulin that the estrogen helps it to kind of like keep the testosterone at bay. But once the estrogen declines, then your testosterone kind of takes over, and then you can get that male pattern hairline. Oh, come on in. Looks like the prize patrol is here. All right, so if you haven't been on our Q&As before, this is my son Paxton. He likes to come in and give away some prizes. So what do we have today? We have Paleo Valley Organ Complex. So this is a really great like nutrient, especially with the hair loss and stuff like that. Has everything that you would get if you ate liver and all those organ meats, but you don't have to taste it. We've got our new Glow Below Vaginal Hydration and Rejuvenation. This is not even for sale yet. So someone's going to get a bottle of that. It's amazing. Then we've got our Daily Glow supplement, which has estrogen detox, thyroid health, all of that. And then we have one more, which we're going to give away a hormone test. So this is going to test your estrogen, progesterone, and testosterone. All right, Paxton, how are we going to win? Let's see. I'm going to go in the chat. People are saying hi to you, Paxton. You want to say hi?
Hi.
Are you going to is we going to do a riddle?
Yeah.
Okay. Do you remember your riddle?
No.
You want to go grab it?
Yeah.
Okay.
Where did you put it?
I put it on your little white desk. All right. So Paxton has a riddle for you guys. And so he's going to ask the riddle, and then you guys have to put the answer in the chat. And if you're watching on the replay on YouTube, you can do this too. So I think we're going to give you a different riddle though for the replay. No, we'll give you the same riddle. If you watched all the way to this point, pop the answer in. So Paxton's coming right back. I remember it, Pax, if you want me to whisper it to you. Oh, you got it?
I thought you meant the white table next to my
Oh, no, I'm sorry. You have too many white tables in your room. Yeah. All right, here. Okay, Paxton's going to ask the question. So as soon as you know the answer, type it in the chat. Even if you don't know the answer, just type something in the chat. Okay, go ahead.
What do cats say after telling a joke?
Okay, so what do cats say after telling a joke? All right, there's a little bit of delay, so you guys can pop in, and then we're going to pick 1, 2, 3. We're going to pick 4 people to win the meow. Everyone say the meow.
It is not meow.
They probably would say meow, so that's actually really good, but it's something else. So what would they say? Oh, perfect. That's a good one, but no. Oh, well, that one's close. All right, so Tamara Leader, you are very close. So we're going to give Tamara a point. Oh, that's a cute one too, Terry.
No, I think this is.
Yeah, Tamara Leader says, "Are you kitten?" And the actual answer was just kitten. So very close. So you win. We're going to give you, because you got it right, and I think this is the best prize, the Glow Below Vaginal Hydration and Rejuvenation with a little bit of estrogen in there. So that's going to be so awesome. So it's Tamara. You just need to email us at support@glownaturalwellness.com and give us your address, where to ship it to, and let us know you won Glow Below. So I hope you guys like that name. And then Paxton, we need to pick 3 more people.
Oh.
So this is going to be for the organ complex. So hopefully you're not vegetarian, whoever gets this, because it's made with organ meat. Okay, Lorna. Oh no, oh, I'm sorry. Lorna's going to get something. I'm going to still give it to Lorna, and then you pick the next one. Okay, Jackie, who says pick me, you are going to get a hormone test. So Jackie, you said pick me. You will get the hormone test. It's going to test your estrogen, progesterone, and testosterone.
Okay, anything we do, if you say pick me and I see it, you're going to get picked.
Oh, okay. So you're going to get the hormone test. You just have to, again, email support@glownaturalwellness.com and let us know you won the hormone test, and we're going to send it. And so we need to give out the Daily Glow.
Okay.
So
I know
one
which
more.
one.
Oh, and Lorna, you're going to get a bottle of Daily Glow too. And we'll get back to questions just shortly. Okay, Susan Ustader. You said perfect, and you're going to win a bottle of Daily Glow, and then everyone will also get a hard copy of my book, Hormone Harmony Over 35. We'll send it to you. So make sure, if you won something, make sure that you email support@glownaturalwellness.com with your address and tell us what you want. You look like I have extra arms back there. Oh my God, you're struggling me. All right, Paxton, we're gonna get back to Q&A, but do you want to say bye? Say bye. Thank you so much for being the prize patrol for me.
Bye.
Okay, take care. Okay, close my door on the way out. Thank you so much.
To
You're the best child ever. You're the best child ever.
Bye.
I love you.
Bye.
All right, you guys, I'm going to get back to some questions. If you won, like I said, just email support@glownaturalwellness.com. And if you're watching on our replay, answer the question, and Paxton will pick 4 more people for 4 more prizes. All right, let's see. Back to the Q&A. Oh, I was talking about hair loss. So I talked about nutrition. I talked about thyroid. I talked about stress. I mean, there's also other things like alopecia. There's like bacterial growth on the scalp, sometimes styling products like pulling your hair too tight in a ponytail, although I wear a ponytail all the time, so I'm surprised that I'm not losing my hair yet, but I was blessed with lots of hair. And so what can you do? If it's your thyroid, replace thyroid hormone, support thyroid health. Depending on what's wrong on your thyroid test, there'll be different things. If you have antibodies, then it's going to be more gut health and removing the trigger. So that's going to be the autoimmune, like an autoimmune diet, anti-inflammatory, restoring your gut microbiome. All of those things will help with things like Hashimoto's. If you have a low thyroid output, looking at the root cause, but you can also use like a thyroid glandular, which can be super helpful, or thyroid medication. If it is due to nutrition, make sure you're eating plenty of protein. Protein is king. I talked about protein earlier with the cravings, but protein is what your hair is made out of. And also minerals, so make sure you're getting a good nutritious diet. You're not restricting. A lot of times with the keto diet or with fasting, we can see hair loss. But the good news is if it's your thyroid, if it's stress, if it's sickness, if it's due to styling, if it's due to nutrition, your hair will grow back, but it just takes about 3 months. Now, if it's genetic, because there's a certain age that we're all going to get to where we might notice that the women in our family started having hair thinning and started losing their hair. And there is a pre-programmed life of your follicle. And it's just like your hair will go gray at a certain age. Some people go gray earlier. Some people go gray later. Some people will have a full head of hair till they die. And other people with no fault of their own and no other health issue may have a genetic propensity to lose hair. And if that's the case, then there's not really much you can do lifestyle wise, but it's not a natural treatment, but there is minoxidil, which is, it's now over the counter. It used to be a blood pressure medication, but it is actually FDA approved for hair regrowth, and it does work. It's basically a liquid that you can buy at Walmart and Amazon, pretty much at any drugstore. And you have to put it on daily. So you put it on your hair and you rub it in. Anywhere where you're losing hair, if you're losing hair in your part or your sides, or you just rub it in, and you have to use it daily. I think you have to use it daily for at least the first 3 months, and then you can go to a few times a week. For your hair, most people, I'd say about 80% of the people will see hair regrowth. It's not natural. There are some chemicals in it. It does work for most people, but the downside is that you have to keep using it. If you stop using it, your hair will grow back. Topical, I don't know of any side effects, but you'd want to check with don't take this as medical advice. You want to check with your physician, but I'm always going to be completely honest with you. And I know for women, especially, hair loss can be very, very, it can put a blow to your confidence. It can be a horrible thing, especially if you're losing a lot of hair. And so I'm going to tell you everything I can to help you remedy that. So first, look at any deficiencies, any dysfunctions that can bring that hair back. Hormone replacement can help with the estrogen, progesterone, helping with your follicles if they're going to come back. But for some people, if it's a genetic predetermination that you're going to lose your hair at a certain age, especially if you're a little older in your late 60s, 70s, there may not be much you can do hormonally, but the minoxidil can be something that you can do. And I do have a whole video on hair loss on my YouTube channel, Fixed Hormones with Dr. Michelle. If you're watching the replay, you can just click around and see the hair loss video. And I do have some other nutrients and things that you can do for hair loss on there as well. Because our hormones are meant to decline, why do we go on HRT? Well, just like if it's definitely a choice, but just like if your eyesight declines, most people will get glasses or will get contact lenses or do something so that they can see better. If your hormones decline, it wasn't until the advent of like plumbing and the healthcare changes that we've made and different medicines and indoor plumbing, like I said, and agriculture, that we're able to live longer. So we're actually using that philosophy, we're actually meant to die at the age of menopause, but now we're living longer because of all the things that are available to us. And we're not at war, and we're not we have grocery stores instead of having to like be out in the wild looking for food. A lot of people weren't strong enough to do that, so they would die at the time of menopause or before menopause. A lot of women would die in childbirth, but now we're living longer because we have modern conveniences. But do we want to live sick? Do we want to live all dried up? Do we want to live not sleeping well, with no energy, with no sex drive, with heart disease and dementia and all of the things, osteoporosis? So do we want to live like that, or do we want to do the things that we can do to replace our hormones? And it's a personal choice. Personally, me, I'm going to do everything I can to live healthy and vibrant for as long as possible. But if you prefer to just, gradually, decline, then that's fine as well. But the reason why we want to replace our hormones is because our hormones are necessary for proper functioning of the female body. And most women aren't just thrown in the towel when their period stops. I always say, your final period is not the end of your story. It doesn't have to be the end of your story. There's many, many more chapters. There's more adventure. A lot of women are reinventing themselves or getting new careers. They're doing things with their life now because their children have grown up. They don't have responsibilities. They don't have to worry about getting pregnant. Like all these things are like a new world has opened up. You can look at it that way, or you can look at it as the end. And I prefer not to look at it as the end, especially since I'm there now. And so, you saw my son, he's young, he's 7 years old. And so do I just want to be like, oh, I'm hitting menopause, so I'm just going to sit in my chair and not going to go explore the world with you and go out and play baseball and soccer and do all the things? No, I'm going to do everything I can in my power. Just like I had Hashimoto's thyroiditis, and my thyroid was not working at all when I was in my late 20s, early 30s. And I replaced my thyroid with thyroid hormone. I wasn't like, well, it's naturally declined, so I'm not going to do anything about it. And I look at hormones the same way. Our sex hormones, there's an organ, same thing. If your pancreas stopped working, you would take insulin. And so I don't see any negative to doing so. Why does it make a difference where you put the estradiol cream on your body? It's just how it absorbs. So for 99% of people, you can put it, we want you to put it on the thin areas of skin that do not have hair follicles. So the one in our practice, the sites that we recommend are going to be the inside the forearms, well, pretty much all the way up, but the inside your arm all the way up to your arm, from just below your armpit to your wrist, inner thighs, lower half of the abdomen, behind the knees. You can do the neck, things like that. That's going to be the best areas to put your hormones. However, for some people, they're super sensitive. The hormones get into the bloodstream and into the tissues rather quickly. And so if you want to slow the release, you can put it like on your butt or the outside of your thigh, things like that. And like the lady who had the breast tenderness, sometimes putting it below the waist will lower the symptom of breast tenderness while her body is getting used to it. And so there's just little tricks of how the body kind of utilizes the hormones and where they go first, and the different symptoms that people might experience. But for 99% of the people, it doesn't matter where you put them as long as it's one of the non-hairy locations. The reason for that is because the hair follicle can metabolize some of the hormone and make it less effective. Is yam cream okay for hot flashes? So yam cream, like cream of a yam, is not going to do anything for you hormonally. The confusion is that the bioidentical hormones are derived from a chemical component comes from a yam. So inside a yam in nature, there's a component called diosgenin, diosgenin, diosgenin. And that diosgenin has a similar chemical backbone to our hormones. So this is actually, you can see, whoops, it's backwards. You can see my necklace, that's estrogen. So that's what estrogen looks like. So diosgenin, it looks like this, but it has a few extra things on the outside. And to make bioidentical hormones, you take off those extra things and you're left with the exact chemical structure of estrogen. But if you don't do that, then it's not estrogen, it's still part of a yam. Just like if you have water and you were to take it apart and you were to have hydrogen and oxygen, and water is not the same as oxygen. You can't breathe water, but you can breathe oxygen. With hormones, you can take the estrogen component, you can take the diosgenin and remove the chemical structure that turns it into estrogen, and then it does the things that estrogen does. However, if you just rub the yam cream on your skin, you might get some moisturizing effect, but it's not going to affect your hormones at all. So you can eat all the yams you want. You're not going to change your estrogen, progesterone, or testosterone. And that diosgenin, depending on what they remove from it, it can turn into estrogen, it can turn into progesterone, it can turn into testosterone. That's what bioidentical hormones are made of. In some cases, they're also derived from soy, because soy has that diosgenin too. In our practice, we only use organic yam-derived hormones, but once the hormone has been extracted from that, it's no longer any relation to the yam. It is identical to the human hormone. And then there's something called the United States Pharmacopoeia, which is like a governing body that they will call the hormones USP estradiol, USP progesterone, USP DHEA. And that means it is certified kind of by the United States Pharmacopoeia that it is an actual hormone that's identical to the human body. So you want to look for that on a label, because it's kind of like shows that it's pure and that it's actually a hormone. And so if it says wild yam, it doesn't say USP estradiol, it's not going to do anything for you. It's kind of a waste of money. It might moisturize your skin. Did you say that hormone replacement therapy can help with blood sugar regulation? It can, because of when estrogen declines, you can get damage to your, it changes the elasticity of your blood vessels. And then when your blood vessels are more rigid, they can have issues with blood pressure. Just like estrogen is really helpful for the elasticity of your skin. So if you do this, it bounces back. When my son came in here, His skin is super elastic. And then as you get older, you kind of can get more loss of elasticity. You can lose collagen. Same thing in your vaginal tissues. You lose elasticity, you lose collagen. They shrink up, they get sore, they get rigid, they can tear more easily. Same thing like your blood vessels. And so the replacement of the estrogen helps to keep your blood vessels more elastic and helps with regulating blood pressure. Oh, blood sugar she's asking about. Yes, it's also indirect. So it's an indirect relation of blood sugar. My mother has been seeing virtually no reduction in her blood sugar levels from taking metformin, wondering if hormone replacement therapy. Yeah, so when estrogen drops, you become more insulin resistant. And so all the hormones, it's your endocrine system. So think of it like a team. So if one team member, and like, let's say a baseball team, if one guy is sick, then like you don't have anyone at third base, then the team can lose the game. And the same thing with hormones. You have your thyroid, you have your adrenals, you have pancreas, you've got your ovaries, all of these things are part of the endocrine system. And if one of the players isn't doing their job, then you can have issues with all of the functions, blood sugar being one of them. One of the functions of estrogen also is to lower inflammation. When you have increased inflammation, you can get damage inside the veins and arteries. And what happens is that can cause higher cholesterol, that can also cause higher blood sugar. So we've seen studies, many studies have shown that hormone replacement therapy can decrease risk of diabetes. And also we've seen in our practice blood sugar regulation improve, but it does take some time. It's not like you start using your hormones today and your blood sugar changes tomorrow. It is because it's not a direct function, it's an indirect systemic impact of the blood sugar. So it does take some time of having your hormones balanced. Also, you can't ignore diet and lifestyle as well, but all things the same, having balanced hormones and replacing estrogen and progesterone versus not, blood sugar can improve for sure. I can't talk. I continue to have vaginal issues even on HRT. I have sensitivities to vaginal estrogens. Any options other than greasy oils? You might want to try some vaginal DHEA. That can be helpful too. You can also use non-hormonal moisturizers. That can be fine too. Depending on how long you've been on HRT for and how long you went before getting on HRT, it could take some time to reverse atrophy, to restore the pH, to restore moisture. But definitely vaginal moisturizers, vaginal hydrators, it's going to be super important. Our formula is like a serum. So this flow below, this is not available yet, but I literally just got a shipment in. We have a version with estrogen, and then we have a version with DHEA, with the DHEA version is not ready yet. It's hydrating, but it's not greasy. So it absorbs in really nice, but it does, it's a little greasy, I guess you'd say, but it doesn't feel that way in your vaginal area. It feels just hydrating and it does absorb. So you kind of want the lubrication, the little bit of moisture, greasiness, I guess, so to speak. But if you're applying it and not too much, then you won't have like a greasy residue, and it shouldn't like stain your underwear or anything like that. But HRT over time will help to improve the vaginal issues, but vaginal DHEA, vaginal moisturizers, all of that can be super helpful as well. Let's see, are most hormone replacements dosed and inserted as vaginal creams? Not most, I would say there are that option, but I would say majority of hormone replacement is either going to be oral or topical, and then vaginal creams or serums or gels or pellets. There's vaginal tablets that you can use. then the issue becomes uncomfortable discharge of creams. No, you shouldn't have uncomfortable discharges of creams, because with our vaginal estrogen that we use, it's literally you're using that much. So you're going to rub that in, that nothing's going to discharge out because it's going to be absorbed. So let me get a tissue. So that shouldn't be a problem. I mean, there are some vaginal hormones that is a lot of cream that you're applying with the applicator, and then you might have to use a panty liner or something like that. But that doesn't have to be the way you go. I personally wouldn't like that, because I wouldn't want having a mess all the time. So it's just one option. But yes, you can do topical creams rubbed into your arm. You can do pellets, you can do patches, you can do oral hormones, but I don't like oral hormones because of the increased side effects. So I like topical. I like, there's troches also, I mentioned earlier. There's, they dissolve under your tongue. You have to hold them in your mouth for about 10 to 15 minutes. Some people don't like the flavor. Some people can't go that long without talking or drinking, and then so a lot of it gets swallowed too. So it's not supposed to be swallowed, but when you have something in your mouth for that long, you're going to end up swallowing some of it, and then that can contribute to those negative side effects of oral hormones. Carolyn says, Dr. Sands, I want to say I love your content and what you're doing. Thank you so much. Thank you. I'm glad that I hope that this is helpful for you guys. I didn't plan a lot of content and just really answering your questions, because who else is going to do it? I feel like you go to the doctor and you get 10 minutes, if that, and they look at you funny if you ask questions. And even online, you're not sure you're getting the right information, because you might be in a forum and some person might be answering your question, but you don't know if they know what they're talking about. So I try to do this just to help. I mean, yes, I have a practice, and yes, we have a hormone program, but I'm not doing this to sell hormone programs. I'm really doing this because my passion is helping women at this stage of life. So I love sharing information, and you don't have anyone to hang out with right now. You guys are my friends. Let's see. I signed up for a hormone club. Very excited. I'm 39, have PMDD since age 20. I'm so sorry to hear that. I thought coming off birth control pills at 25 would help, but didn't. Have you seen adding BHRT helping women with PMDD? Yes, actually I have. We have several women in our Healthy Hormone Club that have seen major improvements. And so definitely, yes. We also have in our Healthy Hormone Club, you get access to the Healthy Hormone Academy, and there is mega great content in there. So we have nutrition, we have full workouts with strength training workouts, that I'm doing demos of all the exercises, which is really helpful for your brain health. We also have stress reduction exercises for rapid transformational therapists. We have self-hypnosis, which is amazing for people with PMDD, because that activates your subconscious. We have pelvic floor therapy, we have toxin reduction, we have sleep. So it's a 12-week course that you get completely for free with the Healthy Hormone Club. It's called the Healthy Hormone Academy, because I'm really about the holistic approach to hormone balance. Not just, taking hormones or rubbing hormones on your skin. That's great. But if you really want your hormones to really, really work for you, and you really want to enjoy your life in the long term, you really have to have the holistic part too. And so we give you all of that. And I have some amazing coaches, doctors, nurses in our practice that have helped me put that together. And it's absolutely amazing. So you will get wonderful help from there. And we have, like I said, we have our rapid transformation therapist on staff. You can always work more with her, and you will see big improvements. So I'm so excited to have you, Carolyn, in the program. And now you have access to the portal. You can book 15-minute calls with our staff anytime you need extra help. So let us support you, and I'm more than happy to give you some tips and tools. See, one of the supplements I was told to take is saw palmetto. What does that do for you? So saw palmetto is one of the herbs that can help to push your testosterone down the less androgenic pathway. So just like Estrogen has some metabolic pathways. There's a more favorable pathway. There's a more toxic pathway. Testosterone can also break down two different pathways. And so there's the androgenic pathway that goes to DHT. And DHT is the more potent androgen. And that is what gives you the hair loss. That's what gives you the acne, the weight gain, the negative symptoms of testosterone. And some people just genetically have a preference for that pathway. And so even if your testosterone is normal level, if you have a preference for that pathway and your estrogen and progesterone drop, then you might start seeing facial hair, acne, hair loss on your head, belly fat, irritation, aggravation, irritability. So if you start to notice those things, then you can push that pathway down the less androgenic pathway by using, we like to use a combination of saw palmetto, pygeum, and nettles. That's the natural route. Or you can do something like spironolactone, which is the pharmaceutical, to push that pathway down the less DHT pathway. So also things like spearmint tea can be helpful as well. And NAC, those are all things that can help push that pathway, but that's what saw palmetto does. And a lot of times it's marketed as for hair loss, because it's one of the things that helps to push the testosterone down the less androgenic pathway. And like I said, it can be because you have too much testosterone, but it can also be because your testosterone is not opposed anymore by the estrogen and progesterone, and now you're testosterone dominant. So those are a couple of reasons why you might want to push that pathway. Let's see, right around the time I stopped testosterone and DHEA, but continued taking estrogen and progesterone, I noticed my hair thinning, breaking off. Should bioidentical hormone doses be titrated down? I stopped cold turkey. Does this hair breakage sound normal? I want to get back on testosterone and DHEA, but the hair is still breaking off. It could have something to do with your hormone balance overall. If you know that when you stopped certain hormones cold turkey, that things started happening, then I would either get back on the hormones you're already using or look at other things that might have been going on in your life, stresses. It could be just from the stress of the hormones, but remember, it's whatever you did 3 months before. So it could have been, it's not the stopping, unless you stopped and then 3 months later your hair started falling out. But if you stopped and then your hair started falling out, it might have been the actual dose of the testosterone and DHEA that made your hair fall out. So you'd have to wait another 3 months in order to see if stopping it helped. So hopefully that's helpful. You can always test your hormones and see exactly what's going on with your hormones, and that can be helpful as well. But remember, whatever's happening to your hair at the moment is a reflection of what you did 3 months ago. So hopefully that's helpful. What is the most accurate hormone testing? Depending, it's dependent on what you're testing for. So if you're testing, you're not on any hormones at all and you want to test your levels, you can do blood, you can do saliva, you can do blood spot, you can do dry urine. If you are on hormone replacement and you're on topical hormone replacement, whether it be a patch, a gel, a cream, then you want to use either saliva or blood spot, because those are going to actually be able to pick up those topical hormones in an accurate way. If you're looking for metabolites, like how your hormones break down, and you're not on hormone replacement therapy, or even if you are, but you just want to see how your hormones break down, but not necessarily your total level of hormones, you do dry urine testing. So there's a lot of different accurate ways to test your hormones, but there's certain scenarios where different tests are going to be better. Like if you're on sublingual hormones, you don't want to do a saliva test because you're going to contaminate the sublingual hormones with your saliva test. So you want to work with a practitioner who understands the different scenarios where one test would be better than another. Okay, what time of day is best for vaginal cream? How long after application is it safe to have sex? So depending on what type of vaginal cream you're using. So for instance, we have our Glow Below, the one that has estrogen that I showed you. That I'd recommend either after sex, in the morning, at least an hour before sex, because it's going to be, all the estrogen is going to be fully absorbed into your vaginal mucosa and won't transfer. However, we have the version with DHEA that heightens your sensitivity and it makes sex more enjoyable. So that I would use right before sex. or even like as a sexual lubricant. So depending on what you're using, or if you're just using vaginal cream without any hormones, you can use that at any time. So yeah, that's how that works. Why do I do better with estriol than estradiol? So estriol is kind of like the very weak version of estrogen. It's not going to do any of the things that have to do like bone health, brain health, heart health. Generally won't help that much with hot flashes, but can if you don't have, it's kind of like a helper to estradiol. Let's see, my hair was luxurious when I was only on estriol, fell out when my doc dropped the estriol and put an estradiol. Not typical. There might have been other things going on, or you might be on too much estradiol and it's causing like inflammation or some type of like reaction in your body. But generally adding estradiol would help with your hair and not hurt it. Not really sure. So I have to see what else is going on in your life maybe, or what else is going on with your prescriptions. Is there any point in taking HRT if you're already out of menopause? There's every point in taking HRT if you're already out of menopause, because you are in a depleted hormone state. So yes, I mean, you're asking like because you don't have the typical symptoms. So if you're not having hot flashes, night sweats, vaginal dryness, fatigue, brain fog, if not having any of that, if you feel awesome, the benefit to taking HRT would be to preserve your brain health, to prevent amyloid plaques from forming, to prevent Alzheimer's, to prevent diabetes, to strengthen your bones. The number one reason for osteoporosis is estrogen decline. So it's almost impossible for your body to build strong bones without estrogen. This is why we see a lot of old frail ladies. Another reason is for muscles. Women need estrogen in order to maintain muscle mass. So just having a strong, be able to maintain your balance, all of those things. So yeah, I mean, there are a lot of benefits. How long would you take it? That's a personal preference. So there's show that you get a compound effect of the benefits. So if you take hormone replacement for 3 years, you have a big benefit to your bones, your heart, your brain, and that is like a compound effect for the amount of time you took it. Now, when you come off hormone replacement, you're still protected, like you still have that benefit of that extra time on the hormones. But if you have like vaginal dryness, low libido, fatigue, brain fog, those things will gradually come back because it's almost like if you put gas in your car and then you stop putting gas in your car, you're not going to be able to drive anymore. But you have the benefit of being able to go places that amount of time that you had it. So there is some like compound effect benefits, like the protection from like colon cancer and certain types of cancers. That is, you get that in the bank, kind of, you get that extra time with the hormones that gives you further protection and extends your life. But when you get off the hormones, then you will start to notice some of the symptoms of hormone decline come back. So how long would I take it? I would take it till the end of my life. But different people have different reasons for stopping hormones. One, financial, like if you can't afford hormones. Two, if you want to grow old with your spouse because your spouse is starting to get fatigued and frail and starting to look older and not being able to be as active and not sexually active anymore, and you just want to kind of match them. That's one reason. But if you just want to stay like as vibrant and healthy and your brain stay as strong and you look as young as possible, then you can take them as long as you're on a proper dose and you're being monitored and you are on a safe delivery method that's not going to affect your liver, like topical. I would say you can take them as long as you want to. See, the lab received my sample this past Monday. When will someone contact me to go over the results? Sorry if I'm impatient. The lab takes about 2.5, sometimes 3 weeks to get the results back to us. So if you're in the Healthy Hormone Club, as soon as we get those results back, we will send you a message through your portal to let you know that your test results are in, with a link to book a consultation with one of our hormone specialists. You'll be able to pick who you meet with, and then you'll meet with them, and then you'll get like your protocol and your hormones will get shipped out. But in the meantime, go through that Healthy Hormone Academy and start implementing some of those practices and the food kind of. It's not like you don't have to follow the meal plan, although you can if you want inspiration, but just follow the like 4 like food guidelines, do some of the workouts, get some of that information, and then before you know it, your hormones will be back. Your test will be back. Let's see. I'm on bioavailable progesterone cream in my 40s, or I was on it in my 40s, and I have fibrocystic cyst in my breast, which I didn't have before. What would be your thoughts as why this would happen? Well, progesterone cream doesn't cause fibrocystic breasts, but it doesn't stop fibrocystic breasts from happening, especially if you are exposed to toxicity in your environment or you have other things going on. So I wouldn't probably say that the cause of fibrocystic breasts was that you took bioavailable progesterone cream in your 40s, but why it happens, I think I talked about this earlier. Number one reason for fibrocystic breasts is all of the toxicity in the environment. Also, poor estrogen detox, whether it be genetic or due to liver dysfunction. And so all those things can be part of that. I'm almost 3 years in menopause. I'm 58 years old. And also fibrocystic breasts are like 80% of women get fibrocystic breasts at some point in their life. So it is not uncommon, especially in the environment that we live in today. Let's see. I'm almost 3 years into menopause. I've been told it's a long time since I've used progesterone cream. Would you recommend your Healthy Hormone Club and starting BHRT? Well, one thing I'd also recommend is castor oil packs on your breast tissue. Castor oil is very inexpensive, very effective. I don't have a video up just yet, but I did make a video on fibrocystic breasts and using castor oil packs to reduce fibroids in both breast and uterine tissue, ovarian cysts as well. So fibroids and cysts can be kind of like dissolved and softened with castor oil packs. Also, the detox is going to be super effective, but yes, you can still do hormone replacement therapy if you have fibrocystic breasts, and it can help to have your hormones in balance, because even if you are 58, you can still have some imbalances in your hormones, and so getting those balance can help with the whole process. Can I take Daily Glow daily if I don't have a thyroid? Absolutely. It doesn't interact with Synthroid because it doesn't have any. Daily Glow does not have any thyroid hormones in it, but it does have nutrients to support thyroid health, things like selenium, Atlantic kelp, which has iodine, which is what your thyroid hormone is made of. And then it has your adaptogenic herbs to support lessen the amount of stress on your thyroid. So you can definitely take it every day. It doesn't interact with your thyroid. It's meant to be taken every day, which is why it's called Daily Glow. But yes, it's totally healthy for people that have on thyroid hormones, not on thyroid hormones, have Hashimoto's, have high or low thyroid. It's supportive of balance. Let's see, I'm 64 and I know my age. It takes longer for bioidentical hormones to work. And I know everybody is different. How long does it normally take for hormones to begin working? It's very individual and depends on the different symptoms. So generally symptoms like sleep, irritability, mood, brain fog, those generally, for most women, some women are going to notice changes immediately, but most women it's going to be about 6 weeks before they start noticing the initial changes. And then in about 3 months, you notice more changes. We might adjust your dose if you're not getting the full benefit yet, but over time, 6 months, 1 year, you'll see improvements gradually. And the longer that you have your hormones balanced, the more improvements you'll see, especially things like rapid aging, things like hair, things like bone. That can take 1 to 3 years before you start seeing big changes, because your body has to rebuild itself. Your body has to not only say, okay, we've stopped the hormone decline, we're putting hormones back in, but then it has to use those building blocks to kind of build things back up. So it can take a little time, but depending on the symptoms, some symptoms alleviate faster than others. And everybody is different. That's true. What basic tests should I have done? I'm age 61, and you describe my symptoms to a T. Well, as far as hormones are concerned, I would recommend, like, in a perfect world, I'd like, oh, get all the tests, right? Get all the tests, because like the more information you have, like the better. But as far as hormones are concerned, estrogen, progesterone, testosterone, DHEA, those are like the basics. You can also add on cortisol and thyroid if you want to. But as far as all of the hormones that we're talking about here, estrogen, progesterone, testosterone is really all you need to really see if you have hormone imbalances due to menopause and if you need hormone replacement. And what causes facial hair? So facial hair is one of the side effects of unopposed androgens. So unopposed testosterone, meaning testosterone is either normal or high, and estrogen and progesterone are lower. So that's one reason. Or testosterone metabolizing down the more androgenic pathway to DHT. Or sometimes it's genetic. Sometimes, well, their facial hair, lots of facial hair is usually an androgen dominant issue, but one or two hairs on your chin, one or two hairs on your upper lip. If you're like Italian or from like the Mediterranean area, women tend to be a little hairier than the rest of the world. So you might have a few hairs here and there, and that's kind of normal for some ethnicities. But if you're noticing a lot of facial hair, it generally is going to be due to androgen dominance, which can either be a genetic pathway issue, it could be a imbalance of your hormones, or it can also be related to blood sugar issues, insulin resistance, or obesity that can cause that androgen dominance to be an issue. So hopefully that's helpful. That saw palmetto, pygeum, and nettles, that combination, it's actually one supplement that I believe it's by, I can't remember the name of the company that makes it, but it's available on Fullscript, which is our online dispensary. It's very inexpensive. You can also source it probably at health food stores, but saw palmetto, SAWPALMETTO, pygeum, PYGEUM, and nettles, NETTLES. The combination of those three, super helpful for if it is an androgen pathway issue. Also spearmint tea and NAC and N-acetylcysteine, all those things can help push that pathway. If you wanted to go a pharmaceutical route, doctors might prescribe, or dermatologists might prescribe, spironolactone, which helps with reducing the facial hair. What if there are multiple perimenopause symptoms, like going 2 months without a period, hot flushes, weight gain, etc., but FSH number is nowhere near the menopause range? So you absolutely do not need to be in menopause in order to have symptoms of perimenopause, which is the time before menopause. So you might still have FSH that is not menopausal, but you can still have symptoms of hormone decline. So you absolutely do not need to wait until you're officially diagnosed with menopause to start replacing lost hormones to help you with your symptoms. In fact, in a perfect world, you would start replacing the hormones as they start declining, so you don't get the negative symptoms that are the result of hormone decline. Like, for instance, with skin. So a lot of women, I get probably 10 to 15 questions about collagen loss, wrinkles. You feel like a lot of women feel like they've aged 10 years overnight. Well, as your hormones start declining, like at age 35, you start losing a little bit of estrogen, a little bit of progesterone, and your collagen and elastin starts to kind of gradually decline. But as soon as you hit that menopause where your estrogen and progesterone drop super low, boom, collagen and elastin, you lose as much as 35% in the first 3 years of menopause. And that's if you're not replacing your hormones. So for someone who's in perimenopause, like, I would definitely, I'm not in menopause yet. I'm still perimenopausal. I still get my period, but I'm replacing my hormones just to top them off. I don't even need that much. So I don't use that much. I use a very, very, very low dose, but I want to kind of keep them at that like topped off like level, so I don't start getting the symptoms that I talk to my patients all about all the time. I don't want those things to happen if they don't have to. I mean, can I avoid anything? No, you're still going to age. You're still going to lose some muscle if you don't exercise. You're still going to have cravings if you're not eating a balanced diet. It's not magic, right? It's not magic at all. I don't want anyone to feel like I'm saying that replacing your hormones is going to like save the world, but you can diminish or deplete, or not deplete, but you can minimize, that's the word I'm looking for. You can minimize the negative things you have to deal with if you just start kind of tweaking things now, and it's super simple. Let's see, do you see a decline of hormone levels in women who are exposed to a lot of spiked protein and COVID? There's a lot of research coming out with the vaccines, COVID vaccines affecting menstrual cycles, causing amenorrhea, which is like menstrual cycles going away for a long period of time, and that definitely can affect hormone levels. I have read some studies, but I didn't do the research to see who made the study and whether it was, legit, meaning whether there is unbiased researchers. I have seen some headlines of studies that have shown that like women can go into menopause earlier as a result of either exposure to COVID or exposure to the vaccine, but I can't say with definitive scientific research that I've researched it fully to know whether it's a correlation, whether it's people got a vaccine and they went into menopause, or it's a causation, meaning the vaccine caused menopause. So I'm always real cautious to say things without having the actual real hard evidence, but it's possible. We have seen a lot of correlation with, anytime you have like a outside toxin, a stressor, any of that, then it can impact hormones for sure. What would you suggest for PCOS and endometriosis? So lifestyle, anti-inflammatory diet, exercise, sweating every day, stress reduction, and blood sugar regulation. Those are going to be your top. Some progesterone can be super helpful to balance out those high androgens. So that's kind of on top of the lifestyle. Supplements are real helpful here. But yes, all those things. We work with a lot of women who have PCOS and endometriosis. One of the, again, toxin, I talk about toxins a lot, but more and more research has come out over the past year. The effects of environmental toxins and heavy metals on female hormones is insane. Many of the issues like endometriosis, fibroids, infertility, a lot of the things that we were like, oh, why is this happening, are linked back to toxin exposure. And we were exposed to so many toxins than we've never been exposed to before. So I definitely look in those places for sure. Get rid of plastics, exactly. Arlene says meow. A little late to the party with the meow, but that's awesome. Let's see, where can I purchase a hormone test? So you can go to our website, glownaturalwellness.com, and you can go into the shop. And if you go in the shop, you'll scroll down, it has like programs and it has lab testing. If you click on hormones, you'll see we offer several different hormone tests, but the hormone trio, that's the inexpensive one that tests your estrogen, progesterone, testosterone, and that will tell you where your hormone levels are. And that's the test that we gave out for free as someone who won that. What is the email address to send the email to get your book? So if you want any of the prizes, you want to email support, SUPPORT, at glownaturalwellness.com. And I'll put a link under the replay for a link to how to get a copy of the book for free, the digital version. I also have a really, really informative hormone restoration masterclass that goes deep into the science of symptoms of menopause, different types of hormone replacement, synthetic versus bioidentical, and what that all means. So I'll put a link to that below the replay as well. And then I'll put a link to the trio test as well if anybody wants to get that. And I will put it on sale too for those of you who want to take advantage of that, so you can get the test, and also we'll tell you what it means. Awesome. All right, I'm going to go for another 15 minutes and then I'm going to try to wrap up. My YouTube channel is Fix Hormones with Dr. Michelle. Let me see if I can put a link in the chat for you guys. There's so much great information on there as far as like me just giving clear information. So let me put this in the chat for you guys. Oh, I have not been looking at the chat, but I will real quick. So let me do this. I'm going to let me make sure it goes to everybody. Bear with me real quick. All right, so I just put my YouTube in the chat. And if you guys would like be so kind, you can go over and subscribe. That just helps YouTube know that people are actually interested in hearing about menopause and perimenopause and female hormones. Because, you know, YouTube, I'm competing with like young kids doing crazy things and like cat videos and like all the stuff that like maybe isn't as exciting. There's not as many of us on YouTube that are interested in this stuff, but YouTube will show my videos more if you like subscribe or like one of the videos. So or even like watch them. That all counts towards like YouTube saying, oh, this is relevant, and we'll actually show it to more people. Can it decrease bone loss and height loss? Oh, hormone replacement therapy? Yes, definitely, especially estrogen and progesterone and testosterone are important too. So making sure all of those levels are optimized will definitely help to rebuild bones, slow down the rate of bone loss, and yeah, help you from like shrinking. Like we lose our height because our bones start to get smaller. But in addition to that, make sure you eat your protein and make sure you get some weight resistant exercise. So push-ups, squats, lifting weights. I mean, doing other things, walking and doing yoga and all that stuff is wonderful, but to really get the bone health benefit, lifting heavy things or even doing some push-ups and some squats and things like that, if you don't have any equipment, or resistance bands are also helpful. Anything that's going to put a little bit of pressure against your muscles is going to be really helpful for your bones. It's hard to compete with cat videos. Yes. Awesome. Let's see. I'm going to, oh wait, did I answer that one already? Oh no, I'm going to see my primary care doctor, request a full thyroid panel in a couple weeks. I've been on the same dose of Nature-Throid for years and needed a refill and haven't been retested for a few years. Should I go and fast it and not take the medication that day? Yes. So take your thyroid medicine is usually taken first thing in the morning, but when you get your thyroid tested, take your thyroid dose and put it in your purse or your pocket. Get the test done without your thyroid hormone in your system, and then take your dose immediately after your blood draw, because otherwise your thyroid levels are going to be elevated if you took that dose like 3 or 4 hours or 6 hours before, and you're not going to get accurate reads. So never take a thyroid test right on, like after you've taken your thyroid hormone for that day, unless your doctor wants you to, because he wants to see how you're absorbing it or something. But I've seen a lot of women take their thyroid hormone, get their thyroid tested, and the doctor's like, oh, well, you're still in range. But then if they don't take their thyroid hormone, then they're like way low on their thyroid and they really need to increase the dose, but they're not getting it because they're taking their thyroid medication before the test. Will my test be affected by my day in my cycle? No, your thyroid numbers should not be affected no matter what day of your cycle you take it. The only time you would worry about the day of your cycle is if you're also getting your hormones tested as well in that same blood test. So you're totally fine. Awesome. Let's see, the YouTube channel is Fix Hormones with Dr. Michelle is the name of the channel, or if you type in the @ and Fix Hormones, you should find me, because that's like my channel description. Can you go on hormone replacement if your mother and sister have estrogen-related breast cancer? Yes, you can, and there's actually much research out now showing that women who replace estrogen have a lower incidence of breast cancer and have better recovery should they get breast cancer. So they have less detrimental effects of it. So it's actually protective for your breast. Because if you think about it, and I've talked about this on previous Q&A, so if you look at on my YouTube channel, and you'll see I've done pretty long talks on estrogen and cancer. But when you think about it, who gets breast cancer more? Is it women who are pregnant that have the highest levels of estrogen? Is it women in their 20s whose estrogen's at their peak? Or is it women in perimenopause, menopause, and postmenopause who have low levels of estrogen? It's the latter. And so it's not the estrogen that's causing the cancer, it's how your body breaks down estrogen, and it's the toxicity that's involved and built up in your body. So estrogen itself, estradiol, bioidentical estrogen, does not cause cancer. Otherwise, every woman who got pregnant, who her estrogen levels are skyrocketed, would get cancer when they got pregnant. Does it make a difference where you put estradiol cream on your body? And can you stay in the same spot all the time? We have the spots I'd recommend are inside your forearm, so in the skin without the hair on the inside of your forearm, from your wrist all the way up to right below your armpit. I don't recommend putting it on your armpit because of the hair. Inner thighs, lower half of your abdomen, behind your knee, your neck. You can also put it on your butt if you wanted to. Those are kind of the places that I recommend, because the hair follicles can break down the hormones. And so those are good places to put it, but definitely check with your practitioner. They might have a specific spot they want you to put it. And can you use the same spot all the time? You can. A lot of times we'll recommend switching up a little bit, but generally a lot of women I work with, they take their cream, they put it on one arm, they rub their arms together, and then they rub it on their abdomen and on their inner thigh, and then they're done. Let's see. What are your thoughts on consuming non-GMO soy? So it's really interesting because soy can be helpful for women in perimenopause and menopause, and non-GMO organic soy, especially fermented soy, can be a very helpful part of a diet. There's a lot of research that says like soy is bad for you, but that research is all on men. So research on women actually shows that soy can be beneficial, but I don't recommend eating it like in an unnatural form. So what I'm saying is, like, I don't recommend eating like turkey that's made of soy, and it's supposed to be turkey, but it's soy. But I do recommend edamame or fermented like tempeh. But soy milk, not so much. So I don't recommend soy in forms that it's not supposed to be in, but soy in its natural form, as long as it's fermented or organic and non-GMO, I think can be a healthy part of a diet, but shouldn't be the staple of a diet. So hopefully that's helpful. My doctor has me on DHEA. What exactly does this do for me? So DHEA is the anti-aging hormone. It is the precursor to testosterone. So DHEA will help to improve your testosterone levels, but also improve energy. It'll help with physical performance, muscle, a lot of things that testosterone does. DHEA is just the precursor. Topical DHEA actually converts to testosterone about 50%, so that will bring your testosterone levels up. I'm 60, in menopause, no thyroid due to Graves' disease. Do I need estrogen? So if you're in menopause, you likely need estrogen because your estrogen is going to be low. Definitely get it tested. Depending on how soon you get into menopause, if you just hit menopause, then you may or may not need estrogen at this moment, but I would definitely recommend keeping your hormones balanced. Oral DHEA will sometimes increase estrogen as well, so you want to do testing, because DHEA converts to testosterone, and testosterone can convert to estrogen. So it depends on how your body chemistry is working. So sometimes oral DHEA can affect estrogen and testosterone. So you definitely want to test your hormones. Let's see, I have Sjogren syndrome, drying of the eyes and mouth. I'm confused, I'm concerned about vaginal dryness. What can I do for this? So vaginal dryness, and several things you can do. One, vaginal lubricants, vaginal moisturizers, whether you choose with or without hormones. Vaginal estrogen is wonderful for restoring the integrity of the vaginal wall, restoring the pH of the vagina. helping to avoid UTIs, helping with sensitivity, helping with incontinence, helping with pelvic floor health. So vaginal estrogen is great. Vaginal DHEA is also good. But overall, just moisturize. We moisturize our face, you guys. We use serums and creams and eye creams and lip balm and all the stuff for our face. Otherwise, our face would get super dry and tight and cracked. But our poor vaginas, like, we just ignore them. And so, like, our glow below, we're saying it's skincare for down there. And so that is kind of like what I feel is like we need to take care of our vagina. We can't just like ignore her and expect everything to be great. So we definitely need to rehydrate and replenish that. So definitely daily vaginal moisturizer. There are many, many brands out there. You just want to make sure it's clean. No ingredients that you don't know what they are. Like our product has like very few ingredients. It's shea butter, sunflower oil, almond oil, estradiol, estriol, cocoa butter, beeswax, vitamin E, and hyaluronic acid. That's it. That's all of what's in it. So you don't want a bunch of toxins going down there. So you want to make sure it's super clean, super pure, and just moisturize, lubricate if you're having sex, and consider replacing estrogen vaginally if possible. I think that would be super helpful. All right, one more question, and then I'm going to make dinner for my son. But you guys, we've had over 100 people on for 2 hours. I will do these every other week to answer all of your questions because it's so much fun. I hope it's been super helpful. I will go through the chat. I'm going to download the chat and I'm going to download the Q&A, and I'll try to make additional videos on some of the questions that were more in depth so that you guys definitely get your questions answered. But let me go ahead and ask a couple questions. Let's see. If you're asking for pricing on testing, you can go to our website, glownaturalwellness.com, click on the shop, and you'll see our pricing. We do run sales on a regular basis. So if the price looks high, just make sure you're on our email list and look for when we run sales. Let's see, I have an IUD and I have no sex drive and was told to put it in to help with perimenopause and to prevent becoming pregnant. Okay, IUDs are a form of birth control. So yes, I have no cycle now and I don't know where I am at. That's definitely an issue. A lot of women don't even know if they're in menopause when they're on birth control. I've gained weight and have a hard time losing it. Should I get it taken out? That's going to be a personal decision. If you're still looking for birth control, you can do a couple different things. So you can definitely test your hormones and see where you're at. You can choose to keep your IUD in and replace hormones to help with some of your symptoms. You can take your IUD out and use a different method of birth control, like family planning, condoms, something that's not hormonal. Or you can go with a copper IUD, which does not change your hormones, because the IUD is generally going to have a synthetic progesterone in it, which is not the most helpful thing, but it's better than an oral synthetic progesterone. Gaining weight is probably due to hormone decline. Or it can be due to your lifestyle as well. But personally, if it were me, I'd probably take it out, or I might start replacing my hormones. I get tested first, start replacing my hormones, consider taking it out and see where you're at. And then, follow things like a healthy diet, exercise, all the things that we do in the Healthy Hormone Club and Healthy Hormone Academy, and, get your life back. I mean, you're totally fine. You will be able to do this. Is nocturnal related to hormones, or is that just a symptom of kidney disease? It can have, can be made worse by hormone imbalance, but it's not caused by hormone imbalance. Are you able to cancel the Hormone Club membership at any time? What is your response time to member questions? You have a chat with we have a team of 12 hormone specialists, including other naturopathic doctors and nurses And if you're in a Healthy Hormone Club, there's a chat inside the portal. I don't require my physicians and practitioners to work 24/7 around the clock, but generally we respond the same day to questions in the portal. If you email customer service or call customer service for billing or tech questions, then we usually ask you to allow a couple days to get back to us, because we have a very high volume of calls going into our general website. But if you're in the Healthy Hormone Club and you ask questions through the portal, generally get an answer back fairly quickly. And then as far as like how long the membership is, the Healthy Hormone Club is an annual commitment. So you can either pay up front for the year, and that includes all your testing, all your hormones, all your appointments, the Healthy Hormone Academy, or you can choose to do a monthly payment plan. Now, if you're on a payment plan and you cancel before the year's up, then we just will charge you for what you've received so far. So if you've had 2 tests and 2 appointments, we'll just charge you for that. And then you can just stop paying, and then you won't have your hormones anymore. But we don't force anyone to stay in it, but we do make it easier for people. So we know that you might not want to pay up front for the year, so we allow you to make payments, but we'll send you a hormone test, which is more than the cost of your first payment, but we're trusting that you're going to make the payments, and we're not going to wait for you to pay for the consult before we give you the consult. We're not going to make you pay for the hormone clinics before we send them, but it's just that you're agreeing to pay for the 12 months. So that's how that works. Do you personally work with the Hormone Club members, or is it someone else? I have a team that works with me. We have over 3,000 people in the Healthy Hormone Club, and I have a team of naturopathic doctors, registered nurses, master's levels nurses, holistic health coaches. I've trained every single one of my hormone specialists, and they've all gone through advanced hormone training. So they help me with the Healthy Hormone Club and meeting with people. I would not be able to meet with enough people. I wouldn't be able to do that. We'd only be able to have like 10 people in the Healthy Hormone Club. So yes, I have a wonderful, amazing, compassionate staff that but all of the difficult cases or anything we meet on a weekly basis, our whole Healthy Hormone Club staff meets together and we discuss things. So I'm definitely part of the program and guide the protocols, but it's not personally me. I'm doing everything. Let's see. All right, I'm going to go ahead and end it there. You can learn more about the Healthy Hormone Club at healthyhormoneclub.com. And if you want to watch the masterclass that really goes into all the details of hormone replacement, menopause, really it's a it's about an hour long, but I really give a ton of information in there. It's a little more structured than this. That is at fixhormones.com. So my YouTube channel is Fix Hormones with Dr. Michelle, but if you just go to fixhormones.com, that's going to bring you to the masterclass. If you go to healthyhormoneclub.com, that's if you want to sign up for the Healthy Hormone Club. And if you have more questions, my website, glownaturalwellness.com, you can always go there. There's lots of articles about hormones and menopause, and then you can go to our YouTube channel. You can always comment on any of the YouTube videos. I personally answer all of those, and then also social media as well. So hopefully that's helpful. I know there are still some more questions. Actually, I got to almost all the questions. There's just a few more that I didn't get to, but I will, like I said, I will download the chat, and I will continue to make more videos answering these questions. Thank you guys so much for all the love in the chat. What do you need links for? The link for let me see if I can pull up. All right, so hopefully this doesn't start playing. It's going to start playing. All right, there we go. I have a bunch of links underneath my YouTube video, so I'm going to, oh, that's not what I wanted. Let me pull up some links for you guys real quick. Okay.
It's not doing it, not.
Okay, let's see. I'm going to pull up, okay, so we've got, all right, masterclass, electronic copy of my book. Oh, I don't have the whole link here. I will send out a replay tomorrow with all the links that I talked about, so you guys have that. So hopefully this has been helpful for you guys. Thank you so much for spending some time with me. And it's always fun, but I will be doing these on a regular basis in 2023. So about every couple of weeks. And then we'll go ahead and answer all your questions. So hopefully it wasn't too boring. Hopefully I got the questions answered that you wanted to, and keep them coming. Even go to my YouTube channel and comment under any video with more questions, or go to the community tab and ask questions, and I'm happy to make videos. I'm always looking for like what you guys want to know. So it's super helpful for me if you tell me what you want to know about, and I will make videos, do more Q&As. Oh, also on Facebook, we have a Facebook community where I'm going to be much more active this year. So I'll send a link to that with a replay tomorrow as well. So check your email, even if you saw this, open that replay email and look at all the links, and you'll have lots of goodies there. Thank you so much. Happy New Year. Talk to you soon. Take care. Bye-bye.